If you've been advised to get earwax removal, you've probably heard about microsuction. It's one of the most commonly recommended methods today, but what actually happens during the procedure, and why is it so widely used? Microsuction is a modern technique that removes earwax using a small, controlled suction device. What makes it different is that it's done under direct vision. This means the audiologist can clearly see inside your ear throughout the entire process, allowing for precise and careful removal. Unlike traditional methods like syringing, microsuction doesn't use water. This is a big advantage, especially for people with sensitive ears, a history of ear infections, or a perforated eardrum. It also makes the procedure cleaner and more controlled. During the appointment, the audiologist will first examine your ear to confirm that earwax is the cause of your symptoms. Once confirmed, they'll use a microscope or magnifying equipment along with the suction device to gently remove the wax. You may hear a soft suction sound during the process, which is completely normal. Most people find the experience comfortable, and some even feel immediate relief as the blockage is removed. One of the key benefits of microsuction is how quick it is. The procedure often takes less than 30 minutes, and in many cases, your hearing improves straight away. It's also considered one of the safest methods because everything is done with clear visibility and control. If you're dealing with blocked ears or reduced hearing, microsuction offers a reliable solution that's both effective and low risk. For anyone in Barnet looking for a modern approach to earwax removal, microsuction at Hearing First is a straightforward way to restore your hearing with minimal hassle.